Namaste everyone. We are going to study about rotator cuff or musculotendinosus cuff of shoulder. Rotator cuff comprises of 4 flatted tendons which blend with the capsule of shoulder joint and helps in strengthening it. So the best way to remember is by the format SITS. S-I-T-S. SITS. So the SITS muscles which are inserted into the greater and lesser tubercle of humerus. This is the greater tubercle of the humerus and this is the lesser tubercle. SITS stand for the first S, subscapularis, which is inserted into the lesser tubercle of the humerus. Then supraspinatus, infraspinatus and teres minor. Let us understand clearly with the help of this diagram. This is the greater tubercle and this gives insertion to 3 muscles: supraspinatus, infraspinatus and teres minor. The lesser tubercle gives insertion to subscapularis muscle. So the benefit of this rotator cuff is that it gives strength all around the shoulder joint except inferiorly. And this explains that why the dislocation of humerus occur commonly in antero-inferior direction. This rotator cuff also studies the head of the humerus. SITS muscle. Here we see that supraspinatus arising from the supraspinous fossa of the dorsal surface of the scapula. This is inserted on the greater tubercle. Infraspinatus arising from the infraspinous fossa, and this is also inserted on the greater tubercle of humerus, and teres minor. Supraspinatus, infraspinatus and teres minor inserted on the greater tubercle of the humerus. Subscapularis muscle arising from the subscapular fossa on the front aspect of the scapula is inserted on the lesser tubercle of the humerus. Let us see this diagram of the lateral view of the glenohumeral joint. On the top is the supraspinatus muscle, infraspinatus and teres minor. This is the subscapularis. The best way to remember is that all the muscles are arranged in anti-clockwise manner, starting with supraspinatus, anti-clockwise direction, infraspinatus, teres minor and the subscapularis. Thanks for watching. Please like and subscribe.